All right, welcome to December. Beautiful weather here in Minnesota, Wisconsin area. We have snow on the ground. I hope you have a white Christmas as well. A reminder to everybody to look at your member site and know that you have access to all the Zoom calls or all the Zoom calls, but the courses as well. All right, let's jump into our questions. All Friday night into Saturday morning, I had sharp pains, burning, and scraping within the tumor. I hardly slept all that night. Sorry to hear that. All Saturday, I couldn't get comfortable no matter how I positioned my body. My tailbone hurt and caused aches throughout my body. That night, the pain went away and I slept very well. For months, this is what this person calls his tumor, has been purging lots of gray matter and fluids and always smelled foul like death. Since Saturday night, the purging smell has changed to a chemical odor, and so has my breath. Any thoughts on this? Many times when you have like a odor, many times when you have a chemical odor, it can be because you're detoxing those chemicals. Some people have mentioned like a taste, a metallic taste in their mouth. And it's thought that you're detoxing heavy metals, but it can be chemicals too. So when you're many chemicals, maybe many chemical pollutants like paint and solvents and things have heavy metals in them, and they'll give you that metallic chemical taste in your mouth. So if you're detoxing chemicals, it's not uncommon that you have that taste in your mouth and that smell in your tissues. So that's not uncommon. It's quite possible that you're detoxing those things. So that's one possible thing. Sunday, I felt great. Today, I have been lightheaded 3 times when I stand up. You mentioned this can be linked to low blood pressure. Can you have a great day and the next day lightheaded multiple times? Can low blood pressure fluctuate daily? So low blood pressure can fluctuate daily. And also when you're lightheaded, when you stand up, you have to think of anemia. So getting a CBC blood test to make sure your red blood cell count and your hemoglobin count is within fairly normal range is important too. So lightheadedness when you wake up can be low blood pressure, can be anemia, can be extreme adrenal fatigue. Those are your main differential diagnoses for lightheadedness upon arising. So make sure you check into those things. When I feel my lump in my breast, is everything that I'm feeling cancer? Or is some of it scar tissue, inflammation, thicker fatty tissue, etc.? Put another way, I'm wondering if the size of what I feel with my fingers correlates at all with the measurements on my scans. Well, I would agree with your assertion here. You don't know. Is it cancer or is it scar tissue? Is it inflammation? Is it just the inflammatory response of your immune system around the cancer? That can definitely be true when you're feeling the lump, when you're palpating the lump. And it also could be definitely true with the MRI or CT scan of the lump. Believe it or not, that's what could give false positive enlargements. And we've talked about this lots of times before, so I know that you guys have heard this, but you got to be careful not to just take one test or one objective or subjective finding and then correlate it to your cancer getting worse. You got to weigh that with other things too. So let's say, okay, the scan shows an enlargement. I feel an enlargement. My tumor markers are up. My blood markers are off. Well, it's probably a pretty good chance the tumor's growing. But if my scan shows a slight enlargement, but I feel great, my tumor markers are actually better, and my blood markers are good, then you got to go, huh, at least you have to ask the question, is that a false enlargement of the tumor, and not a true enlargement? Is it because of the inflammatory response that everything that I'm doing to try to stimulate an immune response against the cancer, is that really what's being measured? Um, you're never going to know that first with complete certainty. So that's where you have to, not just be a technician. Like so many doctors are trained today just to be a technician. They run this test, that's what it says. They look up on the computer what that means, and then they follow their procedure basically to cover their tail, instead of being the Dr. Welby of days gone by and try to ascertain through multiple sources and to give a better diagnosis. So you have to kind of be that investigator in your own place, for your own body. So yes, it could be scar tissue, inflammation, etc. It could be. So you want to just weigh that out. We did a cheek swab. Do I need to take pro-hydroxycobalamin? So the pro-hydroxycobalamin is based upon your genetics typically. So if that's what was recommended with your genetics, I didn't change that. So pro-hydroxycobalamin is B12. So really, there's no harm in taking B12 ever. You really can't get too much B12. Your body will flush it, so there isn't any harm in continuing to take it. The dewormer I'm taking to take 4 times a week, is that spread out through the week or in a row? Typically, that's in a row. So you do Monday, Tuesday, Wednesday, Thursday, and you take Friday, Saturday, Sunday off. Doesn't make any difference what days you take off. But typically, it's done in a row. That's a good question. So regarding feeling the tumor, it sounded like, this goes back to this question, sounded like what you're saying, even if the MRI doesn't distinguish between cancer and inflammation, scar tissue, etc. Is that correct? It doesn't perfectly discriminate between those things. It can show a false positive enlargement at times. So nothing is perfect. So if you ask the radiologist, they'd say, oh, absolutely not. I can tell if there's inflammation in there. But in truth, it's difficult to tell that. So it can be inflammation that's around there. That is a possibility. What other blood results should we be monitoring besides tumor markers? So other blood results that you should be monitoring besides tumor markers, I'm going to jump down here, is it's good to do a CBC. So a CBC is a complete blood count. So a complete blood count measures your total red blood cells, your hemoglobin, your white blood cell, and the breakout of all of your white blood cells. It's good to run that because anemia can be common in cancer, especially as if the cancer is progressing. So you want to make sure that you're not anemic. You want to make sure your white blood cell count isn't way off, that your platelet count isn't way off. So running a CBC is something that everybody should be running on a somewhat regular basis. It's a very inexpensive test to run. If you went into the ER for anything, that'd be the first thing they'd run. The second thing that they'd run is a complete metabolic panel. So a complete metabolic panel is going to look at all your liver markers. It's going to look at, the alkaline phosphatase and and your cholesterol and your albumin and globulin proteins in your blood. It's going to give just another good picture. Now understand, let's say you didn't know you had cancer and you went in for let's say I don't know, maybe you're having symptoms and you went in and you did a CBC and a complete metabolic panel. Those most likely would be completely normal. So there isn't anything in the CBC or the complete metabolic panel that diagnoses cancer. There are things, though, that are what are called ominous signs. Ominous signs in especially the complete metabolic panel would be lower blood proteins, globulin and albumin, lower let's say your cholesterol has always been about 200 and you go in for annual exam and your cholesterol is down to 120 and you're not on any cholesterol lowering medication, you haven't made any strong dietary changes, that's an ominous sign. And an ominous sign is an ominous sign for cancer. And your albumin and globulin are low. That's an ominous sign. So there are some things that can point to different things that are not specifically cancer, but they can point to different things. If you already know you have cancer, running those things would be a good thing. Now, how often should you do them? Well, if they're within normal range, then maybe every 3 months. If they're not within normal range, then getting them run every month could be good, especially if you have low hemoglobin and you're really keeping an eye on if you have, more moderate to severe anemia, you should do it every month. If they're within, all your tests are within normal range on your CBC and your complete metabolic panel, maybe every 3 months would be a good idea. At the doctor, they said I should be eating kale instead of spinach. I thought that was opposite. Which one should I be eating? So, should a cancer patient eat kale? Well, kale is good for you, right? It's a good thing to eat. It's big in the vegan community. Kale has some really distinct benefits. But what are those benefits? The real distinct benefit of kale is the nitric oxide content. There's more nitric oxide in kale than spinach, about 4 times as much nitric oxide in kale than in spinach. Is that a good thing or a bad thing? Well, it really depends on your diagnosis. If you have cancer, especially a hard cancer, meaning not leukemia. So if you have a cancer that is not leukemia, you really shouldn't be eating a lot of kale because you really don't want to increase your nitric oxide levels. Well, who would want to increase their nitric oxide levels? If you don't have cancer, nitric oxide is really good to help dilate blood vessels. So nitric oxide would be the thing to take if you had high blood pressure. So if you have high blood pressure and you don't have cancer, kale is really great for you. Or even taking a nutritional supplement that has nitric oxide in it. So that's huge benefits for blood pressure patients. So people with high blood pressure, people with erectile dysfunction, nitric oxide is the supplement to take. But why would a cancer patient not want to take nitric oxide or eat kale, which is, out of all the foods that you can eat, kale has more nitric oxide in it than anything else. So why would a cancer patient not want nitric oxide? Because nitric oxide increases what's called vascular endothelial growth factor, or what's called VEGF in short. I write about this in my book. VEGF, vascular endothelial growth factor, helps stimulate growth of new vessels. Well, that's exactly what you want if you have heart issues, but that's not what you want if you have a hard cancer, meaning a tumor, a mass, because it can increase the growth of new blood vessels into the cancer and can help feed the cancer, so the cancer continues to grow. So I would not use kale if you have cancer. Now, if there's something you're eating that is a little bit of kale in it, that's fine. But you don't want to make a kale smoothie. You don't want to go out of your way to eat kale. So cancer patients do not go out of their way to eat kale, and you certainly wouldn't substitute kale for spinach. I had read that arugula is also high in nitric oxide. Well, arugula and spinach, but kale is 4 times the amount of nitric oxide as spinach does. So I still would make a spinach smoothie with cancer, or arugula smoothie. But if you're going to have some spinach leaves or arugula leaves in your salad, that's fine. If there's a little bit of kale in your salad, that's fine. Just don't be, going out of your way to choose kale. this question on the chat seems appropriate to what we're talking about. Are you aware of any supplements to ease the side effects of lorazepam withdrawal? So lorazepam is antidepressant medication, and the problem with it is that it and the class of medication that lorazepam falls under can increase the amount of dopamine receptors on the neurons. That's how it works. It increases the amount of dopamine receptors on your neurons, and that's the whole purpose of it. The problem is that it that isn't repairable. So if you go off of it, you can have some serious side effects of being on it, and you can have serious side effects of going off of it. I'm not a fan of any of that class of medication for that reason. And those neurons, when they reproduce themselves, they reproduce neurons that have that elevated amount of dopamine receptors on the neuron, which is not a good thing. So it creates a dependency and creates literally a change in your brain that you can't unchange. I'm not a fan of this whole class of medication. Is there some things that can help with the withdrawal? I'd say go to our website and look up or go to our YouTube channel and look up the video called Brain Inflammation, because the same things that you would do for microglial priming issues, which the big word, but you'll see an explanation of that in my video under brain inflammation. I have a blog post about it, but it's a video on YouTube. Would be the same thing you would do to help with withdrawal of any of these type of medications that affect your brain. I can't speak to the dosage of what you would do with withdrawal. I can speak to what you would do to help clean up your brain. So I would follow this video. I actually have let's see if I can change my share. Can I? I don't know. Let's see real quick. New share. Let's do this. We've done this. Let's try it. Let's do right there. I actually had that slide up because I'm going to actually be talking about it in an interview that I'm doing today. This is the video. It's called neuroinflammation. That's what it's called. I think it's under brain inflammation on the blog post, but it talks about M1 and M2 priming of your microglial, and what to do about it and how to push cells, the inflammatory process in the brain, to M2. It's the same thing you would do to detox some of these anti-anxiety, antidepressant type medications. You go through these phases of lifestyle, try to very, very, very mild exercise. And I talk about it in the video. This is just the slide presentation. Make sure this person's not taking any alcohol, staying away from pollutions, toxins. You can follow this video, getting off of gluten and dairy completely, because these are highly inflammatory. Consider going on a low histamine diet and running some other tests for anything that could cause inflammation in the brain. So this would be the thing to help you. Here's some specific nutrients that have high amounts of the flavonoids in it that would help as well. Okay, let's see if I can switch back to our other share. Look at that. Hey, take a look. Okay, so you can see back to our video again. Let's share. All right, so what are your thoughts on Simply O3 water, which is oxygenized water, 16 ounces a day? I don't see any problem with that. Um, again, it's just ozonated water. Um, I don't see that it's gonna really help much past the stomach or first part of the small intestine, but it's certainly not anything wrong with taking it. It certainly won't upset the hydrochloric acid content of the stomach. So there's nothing wrong with that. I know that chemo does not kill cancer stem cells or circulating tumor cells. What can kill these cancer stem cells so they don't come back with the flurry? Well, that's what you're using the Rife for. That's what you're doing all the immune stimulation for. That's what we're trying to accomplish with everything that we're trying to do. So you're doing the right thing. That's where it's so dangerous. I've had patients that get a complete clean bill of health from their oncologist, and then they stop using the Rife. It's like, oh my gosh. And then 6 months later, the cancer comes back with a vengeance. Like, okay, I'm not saying that the Rife would have kept it at bay, but I certainly think that's your best bet to keep these circulating tumor cells from taking off and, raising a family. You got to continue to treat as if you're in the same situation. So don't ever stop using your Rife. That's what I'm saying. Okay, I had to keep this in a low font because it's a lot of questions here. I've been bloated perpetually for the longest time now that I can remember. My stomach distended and my tumor so large and inflamed. They seem to go hand in hand together. Inflamed as 2 times they both went smaller, and I'm wondering if I made a connection that could be possible. The first time that both my stomach and my tumor, so this person has a tumor on their thyroid, and so it's two completely different areas, but they're trying to put this data together that when their stomach is bloated, their tumor, their thyroid gets larger, and vice versa. So first time was about 5 days after I began a complete water fast. Around the day, I got a flat stomach back and noticed my tumor noticeably smaller and when swallowing. Second time was just now after being away for Thanksgiving, 5 days, eating the standard American diet, including binge eating and gluten takeout pizza, and everything not healthy. But the next morning, when we arrived back home, I was flat stomached and my tumor was much smaller. Well, isn't that interesting? These two things, same in both these times, is that I wasn't taking any supplements, forgot them at the trip. Could it be possible that the supplements are causing me to be inflamed? I'm back on taking just 3 days and my stomach and tumor are big again. Oh, well, it could be probably more than the supplements. It could be maybe the capsules. I have had people sensitive to the capsules, and that's causing inflammation. My husband pointed out, which I had forgotten, but I had said in passing about a year ago that I felt the supplements were making me bloat because I had stopped them for a bit when I ran out and it was fine. Then, too, I had made the comment, geez, I'm better without them, or something like that. I had forgotten because it was more than a joke, not really thinking that it was why that I was just randomly not bloated. I'm truly starting to wonder if there's a connection. Very well could be. So I would experiment a couple of ways with this. I would experiment, number one, I would start opening up any capsules that you can and putting it in a smoothie and see if your bloating goes down. Well, let's say that makes a difference, then it could be a sensitivity to the capsules. Even though they're natural capsules, still, I've had people had sensitivities to natural gelatin type capsules. Secondly, if let's say, that's still a problem, then I would just cut them all out again and see if the bloating goes down, and I would add one at a time. So you got to kind of distinguish what it is. It could be something and one thing you're taking. I don't know. So that's what I would do. I would do a process of elimination like that. My original cheek swab in March of 22 indicated heavy metals as a cause. That may be true. So I'm not looking at your chart right now. Heavy metals are a common cause of cancers, or at least in part, like we talked about in the first part of this, chemicals. You think, oh, how do I get heavy metals? They're in it so many things. They're in so many chemicals that we're exposed to too. I'm due for another cheek swab, and I'm halfway through having my amalgam fillings removed. Should I wait until the fillings are removed? No, I would go ahead with it. Because we're not going to test for cause again. So there's no need to. So we're going to test for disbalancer. So um, I would still go ahead with it. Um, that's it. Let me expound upon that question because people do ask a lot of times. I have mercury fillings. Should I get those removed? In general, yes, everybody should get their mercury fillings removed, but you have to be healthy enough. So if you're not doing well, your cancer is growing, you're feeling sick, you're not healthy enough to get your fillings removed. But if you're pretty stable and you're feeling well, you should go to a biological dentist and get that checked out. You do want to get them removed correctly with a mercury vacuum and a rubber dam placed and nasal cannula in. You want to do it correctly through biological dentist who knows what they're doing, but everybody should have their mercury out of their mouths. Any other questions? All right, well, we will see you all in 2 days. Um, and I'll be praying for all you guys. All right, love you much. Bye-bye.